Hello. So I'm going to give a short overview of health disparities. And one of the big things is healthcare, our health disparities. And I also put an article in there for you guys to read that I'd like you to read. It's by the Kaiser Family Foundation. Take a look at that. So I want you to know the basic concept of healthcare delivery in the United States. Know the different types of healthcare systems in the U.S., China, Japan, Britain, Canada. Those are some of the big ones that are highlighted that are out there, but go to the Kaiser Family Foundation. Actually, there's a Commonwealth profiles I would love for you guys to look at. Know the difference between market justice and social justice, and understand the basics of the Affordable Care Act. That is the second one. So you need to understand that United States has a unique system. We, unlike most developed countries that have universal access, we do not. We do not have universal access in our country. We do more an entitled approach. Either you have your employer, or you have Medicare, which is publicly funded, and people contribute to it, or Medicaid. And there's a big proportion of our population that does not have health care insurance. In fact, when you look at this, and this is constantly being updated, we are ranked 11th. And I can actually go out to the Commonwealth Foundation site scorecard, and that is constantly changing. But on this slide, we are ranked 11th. And we are constantly struggling because we have some of the most expensive health care in the world. Do you see how we're at 8,508? That is actually higher today than this was with this snapshot from 2011. So at one point I'm going to go out and show you where you can see that information. So what we do is government is a subsidiary to the private sector. So in most developed countries, government plays a central role in the provision of health care. Not so much in the case in the United States, although 43% of our healthcare is publicly funded. In the United States, the private sector plays a dominant role, about 60%, and then about 40-something% is publicly funded. I'd like you to watch Sick Around the World, which provides a great overview of all the different healthcare systems, and I'm going to be asking you to submit a question in your quiz after you watch that. I also will be asking about it in your final exam, too. So make sure you watch Sick Around the World. How is medical care paid for in the United States? So we either have someone has it through their employer, like Blue Cross, Kaiser, and it's either a PPO or an HMO. There's charity care. There are public clinics for communicable diseases and basic health care. There are community health centers, which have a sliding fee and medical programs. There are Medicare, which is for those over 25 and with certain medical conditions, not all medical conditions, like, for example, kidney failure. And then there's Medicaid, which is income criteria. And then we have Children's Assistance, which is Children Health Insurance Program called CHIP, or in California, it's called California CHDP, California Health Disability Prevention. And then we have Veterans Assistance. So these 8 things are how we pay for our healthcare system in the United States. There are major themes. We have managed care, military. We have healthcare insurance for those vulnerable populations. We have integrated delivery, and that's something we're moving toward more. We have long-term health care for those people that need to be in a healthcare system for a long time. Sometimes that is not funded, and that will bankrupt people. And then we have public health. So how do people get their healthcare insurance? So Medicare takes about 43 million. Then there's 6.4 that are also publicly funded. There's Medicaid. So you see how much that's significant. Then there's employer-based, and then we have those people that are uninsured. So this is kind of a nice little infographic that I got from the New York Times. Now, for those people who are insured, they fall into something called managed care, also government uses this too, is the idea of using trying to control the costs. So if someone's in an HMO, which is a health maintenance organization, they have a primary care physician that refers them to a specialist. If they're in a preferred provider organization, they can go directly to a primary care physician, but that person needs to be in network, or they could go out of network to a primary care physician and pay substantially more. And so one of the big things is that we use this approach to try to control our healthcare insurance. Now, I want to make sure that you guys are familiar with the terminology. There's insurance terminology. Someone can go in and they get something called, they have to pay all the time, and it's just a small little payment. It's called a copay. So let's say Sally's not feeling well. She goes in, she gets her medical care, and she has to pay like a $10 copay. But even after she pays that copay, her insurance has something called a deductible. And this is what you have to pay before your insurance will kick in. So for some people, it's a $500 deductible. For some insurance, it's a $1,500 deductible. And some insurance is $3,000 deductible. But it's the idea that that's going to be what needs to be paid before the insurance kicks in. But even after the insurance starts to kick in, there's something called coinsurance, where it'll say, we'll pay 80% of that bill, and you still have to pay 20% of the bill. So Sally could have a $1,500 deductible, right, that she needs to pay before her insurance kicks in ever. So she meets that deductible, and the insurance goes, okay, now I'm going to pay, but I'm going to only pay 80% of that bill. So now you're going to get a bill from the provider of, $1,500 plus another $500. And so now she has $2,000 to pay. And the next time she goes in to use her insurance, she won't have to pay that deductible, but she will always have to pay, let's say, 20% of the bill. But by the end of that year, she can only go up to a certain payment, and then she won't have to pay anything. It's covered 100%. Now, if you're like, wow, that's complicated. Yeah, I know it's complicated. And know that each health insurance, private health insurance, has this, and you need to read it. Now, if you're under Medicare or Medicaid, you're not going to see all this terminology. But if you're under private insurance, like a preferred provider organization, you will see this terminology. Not so much for an HMO, which is like Kaiser Permanente, but this is insurance terminology. I just want to make sure you got the basics here. And definitely, if I didn't cover it in detail, just know that you go out and you can look up a lot of this terminology on the internet. It does a good job of explaining it. But I just want to make sure we had the basics here. So this is a health maintenance organization. This terminology is not used a lot in this organization. This is when you have a primary care physician like Kaiser Permanente, and they act as a gatekeeper, and you pay a front one-time fee each month. Either your employer pays for it or you pay for it, and then it just it's integrated health insurance all at once with a primary caregiver that is gatekeeper. Now, if you're in the military, then you're in something that you're covered by something called TRICARE, and this is a military Medicare system, and it covers all the Medicare services, and again, you have to go to their services and their providers. And then we have something called the safety net. And this is where Medicare, which is one of the largest sources of public health insurance in the United States, and it serves the elderly, the disabled, and those with end-stage renal disease. Then Medicaid, which is the third largest source of health insurance in the United States, and it covers low-income adults, children, and elderly, and the disabled. So Medicare can work with Medicaid. We pay into Medicare for most of our lives, and that is everyone has access to that when they're 65 plus. When they pay into that, they get access to Medicare at the end. And Medicaid is income criteria. And so someone could be on Medicare and Medicaid at the same time. Then we have children's CHIP, which I just discussed at the very beginning, which is insurance to children with uninsured, who are uninsured families. And then we have community health clinics. So that's how we serve our special population in the United States, our most vulnerable. Community health centers, you'll see that they're funded, and they serve 1 in every 12 people in the United States. And they provide sliding care fees, and we have those throughout our county. They serve migrant farm workers, homeless, public housing residents, and children. And then we have integrated healthcare systems. And this is when we really look to shift the paradigm to providing more preventative healthcare services. And one big thing that we're starting to move more to in the United States is using the community health worker, which really addresses the social determinants of health and looking at increasing access to healthcare and having people really use their primary care homes. Another big thing is called long-term care insurance. And this is really looking, often it's not covered by Medicare. It is like a gap, and it really actually puts people into bankruptcy. I have it, let's see if my video's linked here. And I'll post this link there, but it really talks about long care insurance, and I'll make sure that this link is in your module there, so you can look a little more into long-term care insurance. But basically, it's when someone's in long-term facilities for a long period of time and what that covers. But above all of this, we have a big safety net, which is our public health. And this is looking at really making sure that people are healthy. And for public health people, we really want to make sure that people have access to health care. So really addressing that disparity and increasing access to health care. That's why it's one of the big central tenets of public health is getting people into a primary care home and giving them insurance. One thing I want to talk about is market justice versus social justice. And market justice is the idea that we approach healthcare as an economic model, that you basically make it a free market position where people can buy into it. And you do it on a demand for service kind of idea. We've approached that way in the United States, and what we found is that it's becoming unaffordable. And so we're trying to move more to a healthcare for all approach in the United States, and we still have a lot of work to do. For some, it's really kind of a mixed match. You'll see that Germany does a kind of a mix. It does market with a social justice, and it requires that government is involved, because when people don't fit into the economic model, what do you do when they fall out of and they fall between the gaps? And it assumes that government takes a lead position in this approach. And it looks at ability to pay as not as necessary, and it says that healthcare is a right. So in the United States, we're trying to balance these. And when you watch healthcare sickness around the world, you'll see that 5 countries do a combination of this approach. But they use the social justice as a foundation to catch people when they don't fit into the economic model. So one of the big ways that we do this is we have affordable health care, ACHA, and it's the Affordable Health Care Act, or ACA, and it says that we're trying to move people to do this. There have been failed attempts to repeal ACA, but there's still a lot of things that still need to be addressed with ACA, because ACA is, I would say, not completely fully implemented. And there's gaps and things that need to be addressed. It's definitely an imperfect market. We need, in order for healthcare market to be working, it needs that everyone needs to jump in. If not, it's hard to control those costs. And so what we're finding is that we keep on seeing our healthcare costs going up, 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 and up. And the idea is that one way to control insurance is to increase insurance and increase it for everybody. So in conclusion, the United States has a unique system of healthcare delivery. We do provide a great healthcare system, but it's not It's not enjoyed by all Americans. Right now, we have a patchwork of subsystems, and no country has a perfect system. But when you watch sickness around the world, you'll see that there are healthcare systems that use a combination approach. So I want to make sure that you definitely dive into ACA and check out some of my websites that I've talked about. I want to bring out to the website and say that the Institute of Aging, What is Long-Term Care, is a good one. Kaiser Family Foundation is a great one. And my other favorite one is the Commonwealth. And I'd love for you to look at the county profile, country profiles. And so I'm putting that in there too. So you can actually look up the country profiles, and you can see healthcare systems across the world. And that is it.